Hi, I am me. Actually, the story starts when I first became me. Welcome to my mom's special gift. Today, I'm going to take you through an exciting adventure, how my mama and I learned to breastfeed. Actually, let's start at the beginning. As soon as my mom got pregnant, her breasts began to change. They grew tender and got bigger. Her doctor showed a really funny show about why she should breastfeed. Say, maybe you'd like to see it. It could remind you of why you choose to breastfeed your baby. Here it is.
To fulfill your baby's request for an easily available, satisfying treat, introducing the revolutionary new portable baby feeder. It goes anywhere. It's the one-stop, one-shop, no muss, no fuss, unbreakable dispensing marvel. Instead of paying hundreds of dollars to feed your baby, this machine can be yours free. Where, you ask, can you purchase this marvel? It's not found at any store, not even in the mail. No, this treat for your baby comes with the territory. There's no prep, there's no need to guess. It's ready in an instant. Just look under your nose. There it is. It comes in all shapes, colors, and sizes. It's decorative as well as functional. It even comes in pairs. When one's empty, you have a spare. These units improve with age. But seriously, this is not a revolutionary device. Breastfeeding has been around for centuries and has withstood the test of time. It's too bad it's lost some popularity. Fortunately, breastfeeding is back as we discover that breast milk gives babies more than just an easily digestible and nourishing food. It contains some remarkable properties that protect babies from ear, tummy, and lung infections, diabetes, obesity, and even some allergies. While breastfed babies are protected from illness, they still need to see the doctor 3 to 5 days after going home from the hospital for all their immunization and well baby checkups, and if they have a fever, are vomiting, or are dehydrated. Wow, that saves lots of time and money. Breastfeeding is clean, requiring no boiling of nipples, which, by the way, are made of a lifetime guaranteed material that cannot be accidentally pulled off. Breast milk is always the right temperature, never too hot or too cold. It features automatic refill on demand, no need to reheat or refrigerate leftovers. The position for dispensing forces a special closeness for moms and babies. In position, babies can hear the soothing lullaby of mom's heart. Breastfeeding helps moms too. It reduces the risk of breast and ovarian cancer, as well as diabetes and osteoporosis. It slows down bleeding and contracts the uterus. It may not make all moms look like jeans models, but it might help with losing some of those extra pounds moms put on during pregnancy. So relax, you have all the equipment you need. There are lots of other great reasons to breastfeed, but the best reason is that breast milk is mom's special gift to her baby.
My mama sure enjoyed that show, but she wasn't sure that she could breastfeed. She heard that some women have problems. After all, she never did it before and didn't have a clue if she could make enough milk to satisfy me. Fortunately, Mama's best friend Maria is still nursing Angela, her 1-year-old. So Mama got up her courage and asked Maria what breastfeeding feels like. How do you know when to feed Angela and when to stop? Mama really was nervous. Maria chuckled and said that Mama sounded just like she did before she learned how to nurse. Maria said that there are some very important things that all moms need to know about breastfeeding.
To begin with, you start making milk during pregnancy. The milk that first comes out of your breast isn't white and watery. It is usually yellow in color and sticky, but it is milk. Some people call it liquid gold. Some call it baby's first immunization, and some even call it medicine for infants. But its official name is colostrum. What makes colostrum so special are lots of proteins to keep newborn infants from getting infections, and some fats to keep babies satisfied. Colostrum makes a baby's tummy and intestines grow. It coats them and helps them to push out the meconium. There isn't a whole lot of colostrum, because babies' tummies are only about as big as a small marble, so they can't drink a whole lot. Okay, now let's get back to getting breastfeeding started. Once your baby is placed near your breast, your baby will find its way to the nipple and latch on, without needing much help. As he starts to suckle, he will signal your body to make milk.
You should have seen my mom's eyes. She told Maria that she had heard that hormones make breast milk. She didn't know that I made the milk.
Actually, hormones are involved. But if the baby doesn't get onto the breast properly and stimulate it, you won't make enough milk. It is the baby that regulates you. And what is so fascinating, the amount of milk your baby will drink changes from day to day and week to week. In the beginning, Angela fed really often, at least 9 to 12 times a day, but not for very long each time. Then for a few weeks, she nursed less. Then some days she was a little hungrier, and other days she didn't need as much. I just let her take the lead. No wonder my mother calls us the nursing team, only the leader is Angela, not me. Anyway, back to latch on. It is amazing, but newborns can find your breasts and latch on in the first hour of life. I hope you will be able to see this while you are in the delivery room. Ask the nurse to put your baby between your breasts. If the room is cold, cover your baby with a sheet, but make sure you are both skin to skin. Then watch as your baby nuzzles up to one of your breasts. Angela lifted her head, moved her knees, and worked her way onto my left breast, started to lick the nipple, and then suckled. Not all hospitals will allow this, but you still should try to nurse within the first hour of birth. After that, your baby will fall into a deep sleep. Getting born is exhausting. Actually, placing your newborn between your breasts, skin to skin, is a great way to get started breastfeeding in the first few weeks. Just let your baby nuzzle at your chest and watch how he seems to pick a side and move towards that side. You can help him by adjusting his position across your lap and support his neck with your hand. Babies are truly remarkable if we let them take the lead. While you are nursing, talk to your baby, hold him close to you, stroke his back, and enjoy the time together. For comfort, some moms like to put a rolled up blanket or a pillow under the baby. Other moms like to use a stool to put their own feet upon. Remember to sit back and bring the baby up to you. This will prevent backaches. Just relax. Of course, you will want to try several nursing positions to find the one that is most comfortable for you. Most moms like to feed babies in this position, where the baby and you are belly to belly. Some moms like to lie down and nurse, while others use the football hold. This doesn't look as cuddly, but for moms who have had a C-section or who are really big-breasted, it works great. No matter what hold you use, make sure you and the baby are skin to skin. Bring the baby's chest and body in close. Place your baby's nose near your breast. Yes, the baby's nose. The smell of the colostrum will get your little one to open its mouth really wide and put its tongue down. When you see this happen, point your breast towards the center lower part of the baby's mouth and quickly pull your little one in. Imagine trying to eat a hamburger being held in midair without using your hands. That's what your baby is trying to do. Baby needs to get a big mouthful, like you would if you wanted that hamburger. You need to hold the baby's chest and baby in close to you. Let baby lead with his chin. Check to see if his mouth is wide open. Let him plant the bottom of his jaw onto your breast. Watch as he first takes the dark areas surrounding your nipple into his mouth. Keep baby in close. Watch as the rest of your nipple and the top part of the dark area of the breast go into his mouth. Then he can begin to suckle.
Well, Mama thought that sounded easy, but she asked Maria if it would hurt.
Oh, the breast shouldn't hurt if the baby is latched on right, but you might feel a little tug. And in the first few days, you will feel contractions. The same hormone that helps your milk come out contracts your uterus. Although that might be a bit uncomfortable, it's a good sign that nursing is going well. There is something else that might happen in that first week, especially if you are not nursing often enough. Around 3 to 5 days after birth, the milk changes from thick, sticky colostrum to thinner, mature milk. As this happens, lots of fluid comes into the breast. This makes some moms feel slightly full. Other moms get very full. This is normal. Frequent nursing helps to keep the fullness down. If the fullness gets uncomfortable, get help with breastfeeding, as the fullness can turn into engorgement. You can recognize engorgement if your breasts become very hard, feel hot, and look shiny. But even if you don't get engorged, the fullness can be uncomfortable.
Mama asked what can be done if she begins to get this full feeling.
There are several things to do. First, make certain you are nursing 9 to 12 times a day. If you are doing that and still feel full, place a cool pack, such as a bag of frozen peas, on each breast. This should bring some relief. Some women dip their breasts into a bowl of lukewarm water. Others take a shower. Others use a pump. Some women find it helpful to stroke their breasts gently as their baby nurses. It seems to help them. Check with your doctor about taking acetaminophen or ibuprofen if you are in real discomfort. But again, the very best thing is to let your baby nurse. After about 36 hours, this feeling of heavy fullness should subside, and you should only feel full just before the baby is ready to feed.
Okay, so when I cry, Mama just makes sure I am latched on and I start to feed.
Remember, don't wait until your baby starts to cry to begin nursing. Your newborn will show you other signs of hunger way before he ever cries. Crying is the last sign of hunger in the young infant. By then, the baby is frantic.
Wait, Mom is confused, and so am I. You mean I don't have to cry? What do I do to get her to know I am hungry?
In fact, you may not be able to put a crying baby to the breast. Actually, you need to start looking at your sleeping baby. Watch for when your baby will begin to move his body and may make sounds. Then you will see some mouthing motions. The baby may even put hands up near the mouth. You may notice the baby make rapid eye movements, even when the eyes are closed. This is when you should pick your baby up. If you are holding your baby, watch for bobbing head movements and sucking on your neck or clothes. All these are the first signs of hunger. Get the baby undressed, make yourself comfortable, and place the baby on your chest. Let the baby begin to smell your breasts and become alert and interested. Get comfortable, hold him close, and let him start to nurse.
Mama asked how she would know nursing was going well.
Watch the baby, not the clock. Check his latch on. No smacking sounds, no dimpling of the baby's cheeks. His cheeks should be full and making sounds between 1 to 3 chin movements. That sound is your baby swallowing your milk. Bring your baby in for a weight check 2 to 3 days after you go home from the hospital. Keep this appointment. It's critical for your baby's health. Don't forget night feedings. In order to establish good milk supply, nurse 9 to 12 times in a 24-hour period. Check to see if your baby is hydrated. When you touch the skin on the top of his hand, it should feel soft, not dry and rough. During the first week, don't expect 6 to 8 wet and poopy diapers. On day 1, expect 1 to 2 wet diapers. On day 2, this will increase to 2 to 3. By day 4, breastfed baby should have 4 wet diapers, and so on, with pee that looks like clear water. A wet diaper feels as heavy as 3 tablespoons of water. As for poop, expect one black sticky stool on day 1. On day 2, there might be 2 stools that are less black. By day 3 or 4, there will be 3 or 4 poopy diapers and the color changes to green. Every day, the baby will make some small and some large stools. In another day or so, the poop will turn to yellow and can be either seedy or watery looking. Oh, there is something else about a breastfed baby's poop. Sometimes the color of the poop will change depending on what you eat. Beets can make a baby's poop red, and peas can make it green. Another really good way to tell if you are making milk is to listen. After day 3, you should hear rapid swallowing sounds that indicate letdown. Let me show you a great picture. It shows how the tongue is placed under the nipple. The tongue then pushes forward, pulls back, and squashes the nipple against the hard palate. There's a moment of relaxing, and then this rhythmic suckling starts again.
Mama was fascinated, and so was I. Imagine what I will be able to do soon. Mama had one last question. How about when she needs to leave me? Like if she has to go on an errand or go back to work.
You can pump some milk and store it in the refrigerator. Then someone else can give the baby a bottle. But wait until the baby is at least 3 to 4 weeks old before using the bottle. Remember how the baby's tongue moves to nurse? With bottle feeding, the milk comes out so fast and so hard that the baby has to put its tongue in a different position to prevent choking. This can cause some confusion. Also remember, your baby will probably prefer the real thing, so let someone other than you introduce the bottle.
Let me tell you, I am so excited about nursing. Mama was too. I guess she just needed to find someone who she could talk to about all of this. I am glad Maria will be around when I'm born so she can help Mama remember what we are going to do. I hope every mother can find someone to help them. I think I am ready for a nap. Bye!